formally begin. People are entering the room as we speak. Good afternoon, everyone. Thank you for joining us again today. My name is Gedalia Afterman, and I'm the head of the Asia Policy Program at the Abba Eban Institute at the IDC Herzliya. The Abba Eban Institute is extremely happy to have this ongoing cooperation with the Takshashila institution in India. We are both very happy to welcome everyone to this third event in our joint Israel-India Innovating for the Future series. We've been very excited to see strong interest from both sides, and again today. Our goal in this event, in this whole series, is to highlight new areas of cooperation, help develop effective policies, and encourage new partnerships. We've been delighted to be contacted by people from both countries, offering ideas for cooperation. In many cases, we've also been able to connect and create partnerships between people from both sides. We would like to see this continue and would encourage you to contact us with new ideas, or if you want to discuss things further with our panelists. We will share the relevant contact details on the chat shortly, so you can contact us through that. But now please allow me to turn to Dr. Shamhavi Naik, the head of research at Takshashila Institute, who will be moderating today's event.
Thank you so much, Gedalia. Good evening and namaste to everyone joining in from India, and a good afternoon and shalom to our friends from Israel. And welcome to this event, which is part of the series High-Tech Geopolitics, Perspectives from India and Israel. Before we begin, let me take a moment to introduce our two institutions. The Takshashila Institution is an independent center for research and education and public policy. Takshashila is an independent, non-partisan think tank, and we are concerned with how India shapes the world and how the world shapes India in turn. We are also focused on transforming how India is governed and exploring the intersection of technology, economics, and politics. The Abba Eban Institute is a proactive research center and do tank dedicated to the advancement of innovative diplomacy in Israel and beyond. Focused on action-oriented practices and multi-sector approaches, it has been shaping the future of diplomacy and Israel's global standing. Now, on to today's conversation. The theme for the day is Digital Health Post-COVID-19, Strategic Opportunities for India-Israel Cooperation. The advancement of digital technologies is set to revolutionize access to healthcare. Already, there is greater availability of health-related information today. People's access to doctors has improved, and real-time data monitoring is enabling better health outcomes. Moreover, services provided through digital health platforms can fuel international collaborations, leading to exchange of ideas and information across borders. The benefits of digital health have been evident throughout the COVID-19 pandemic. However, there are also challenges that need to be addressed, from the lack of capacity, concerns over privacy violations, to the complexity of digitizing existing fragmented healthcare systems. Keeping these in mind, the discussion will explore the potential for India and Israel to collaborate on digital health with the aim of identifying actionable recommendations for policymakers and entrepreneurs. To discuss these issues, we have on the panel 5 eminent guests. First, it is a pleasure to host Ms. Adi Berzon, International Account Manager, Healthcare Israel. Healthcare Israel was created by Israel's Ministry of Health in 2016 to deliver life-saving and cost-saving healthcare innovation, technology, and expertise to the world in a government-to-government model. Healthcare Israel brings together life-saving Israeli healthcare technology and innovation with the policies and regulations required to move forward, the training systems and expertise needed to implement them, and the foreign governments that have the desire and resources to acquire them. We also have Mr. Rahul Mathan. Rahul is a partner at Trilegal, a leading law firm in India. Rahul has authored numerous articles and thought pieces on various topical issues relating to healthcare and emerging technologies. His 2018 book, Privacy 3.0, Unlocking Our Data-Driven Future, addresses the challenges of regulating privacy in a big data world. Rahul has also contributed to India's data empowerment and protection architecture framework, which is expected to guide the use of digitized health data within India. Joining them is Amir Gilboa, who is the Chief Digital Officer at Healthcare Israel. Amir brings over 15 years of experience and is instrumental in leading strategic programs for international cooperation in the digital health field with many countries. We also have Mr. K. Chandrasekhar, who is the founder and CEO of Forus Health Private Limited. Forus Health is working on the mission of eradicating preventable blindness using technology. Forus's flagship project, Trinetra, is a screening device for common eye problems like cataract, diabetic retina, refractive problems, and glaucoma. Has already been fully deployed in more than 2,800 locations across 40 countries. Today, Forus Health has over 5 products in the ophthalmology space. Finally, it is my pleasure to invite Ms. Neteri Nadivi, who is General Partner at TriVentures. TriVentures is a global early-stage fund that invests in exceptional entrepreneurs. They partner with disruptive ventures with innovative breakthroughs in healthcare with an aim to create a better, healthier future through data-driven solutions and cross-industry convergence. I would also like to thank Ambassador Ron Prosor, Chairman of the Abba Eban Institute, for gracing this event with his presence. Before I head to the panelists for their opening remarks, I have a request for all the attendees. Your cooperation and participation is essential to the success of this discussion. If you would like to ask a question, please post it in the chat box and I'll come to you in due time with the commitment to address as many questions or comments as we can in the time we have. With that, let me turn to our first panelist, Ms. Adi. Would you please share your experience of success stories of international cooperation in digital healthcare and challenges and opportunities for Israel and India collaborations?
Thank you. Can I share my PPT?
Are you able to share your PPT?
No, I can't.
Hatish, Sonia, will you please share rights with Ms. Adi?
Yeah, she has the right.
Okay. So thank you. Hello and namaste, everybody. And thank you for having us here today. As you said, my name is Adi. I'm the International Account Manager for Healthcare Israel. So before I will dive into the cooperation, I will briefly introduce the Israel healthcare system. So for you have more knowledge, I will go through briefly. So Israel has established one of the most enviable healthcare system among the OECD countries. Our system is one of the lowest cost per patient and world-class community and primary care system. Israel has high ranking by international health measurements, like you can see here, expectancy of birth, infant mortality rate, and child vaccine. In the Bloomberg Health Efficiency Index in 2020 ranks Israel fifth in the world. And in this chart, we can see the percentage of GDP on healthcare expenditure for almost 20 years. We can see that the expenditure increased worldwide while Israel managed to maintain it stable. This is what makes our system one of the lowest cost per patient in the world. So when we speak about Israel health system, we speak about also the Israel National Health Insurance. This health insurance makes sure that each resident is entitled to health insurance, including comprehensive basket of health services. This insurance is given to any resident, regardless of his gender, religion, age, location, ethnic background, income, or even the current state of their health. When we talked about the beginning of the healthcare in Israel, we talk about the primary care clinics, the family physician provided by HMOs that I will elaborate in a minute. And then we go further to the community clinics provided by the HMOs, private providers, outpatient clinics, and public hospitals. As I said, that Israel has an excellent community-based primary healthcare. This system is managed by 4 nonprofit health funds. You can see these 4 nonprofit health funds here. These are their names. And every patient in Israel can choose to receive their healthcare services through one of these 4 nonprofit funds that we call HMOs. Patient can move between them regardless to the medical condition. And also the HMOs are obliged to provide the patient quality healthcare services close to their home. As you can see, the patient's satisfaction rates are monitored and reported by each fund. You can see it here. This is the satisfaction percentage by the members. And you can see that they are very high. And here you can see the amount of the people, of the members in each HMO. Okay, so how do we do that? First thing is the structure. As I said, and I mentioned, the community-based health service through these 4 nonprofit health funds. The second one is regulation. The Ministry of Health built and produced models and incentives to improve system efficiency and act as a regulator to define required standards for health organization. The third one, is the quality. The Ministry of Health promotes national programs for measuring the quality of care and publishing them to the public, which enable high quality care and informed patient. Also very important is the medical expertise, high quality education and training provide quality treatment. And last but not least is the innovative technology that we use that Amir will elaborate that later on. So you already said that you're familiar with Healthcare Israel, so just we'll go through it briefly. So as we said, Healthcare Israel was established by the Ministry of Health with a very unique mission to export healthcare expertise, innovation, technology, and to promote broad and long-standing cooperation between the Israeli Ministry of Health and partner governments. Our work combines the 3 sectors, the government, the health organization, and the industry, with an aim to promote and export their healthcare services. We see the advantage of the G2G win-win-win model. And we work in this model, you can see the benefits. We can create integrative solutions of policy, technology, and expertise. We're learning from the experience of the fellow government. We're reducing the cost and we are scaling opportunities and for innovative solutions. And also we are targeting solutions together that needs in both sides. Also very important, there is a value here for the Israeli companies, as you can see here, to work with the international project and with government. Now I will give a brief introduction about the cooperation that we have in the field of digital health. The first one is Israel and IDB cooperation. With the IDB Bank, we worked for the past year. In this cooperation, Israel will provide services of consulting and supporting for digital health projects in Latin America and Caribbean countries. For example, as the National Health Information Exchange Platform, Telemedicine, health cybersecurity big data platform, and the Israeli side will provide case study document consulting services, training in Israel, and also pilot project for light EMR and implementation of a health information exchange system that we will elaborate later. Second cooperation that we have is with Brazil in Sao Paulo. And this project it will provide the Israel National Health Information Exchange System to Sao Paulo Ministry of Health. The project will accompanied by Israeli experts who have done this before here in Israel and implemented the national system. Right now, due to the COVID situation, we are not progressing the way that we wanted, but we hope that after the situation will stable, we will continue. The last thing for me before I hand over is to show the cooperation that we do have with India now. During the COVID-19 outbreak, we worked together. Delegation from Israel arrived to India due to the need of rapid diagnostics and enabling economy restart in both countries. We've been working together, the joint team, and we sampled 1,000 participants per day and collected data in different methods of testing. And right now, the joint team is finalizing the clinical research, and we are intending to work more together on technology development and other joint research. I will finish my opening remarks by saying that I hope we will have much more collaboration in many other fields. And that's it. Thank you for having me here and for your time.
Thank you so much, Ms. Ravi. Could we now have Mr. Amit discuss about
Shambhavi, you're inaudible.
Sorry. Is this better?
Yes.
Sorry. May I now request Mr. Amit to take us through digital health platforms in Israel? And I think there's a question from the audience. May I please request them to post their question in the Q&A? We will take it up once we finish Mr. Amir's opening remarks. Mr. Amir?
Mr. Amir, you're on mute.
Can you hear me now?
Yes.
Yes.
Okay, thank you. I will share my screen. Can you see my screen?
Yes.
Okay, so thank you everyone for having me today, and I want to start talking about the digital health here in Israel and continue what Adi started with. So briefly, I said that in Israel, we are leading in the digital health topics, as you can see here. The amount of the companies that specialize in digital health solutions, pharmaceutical, medical devices, and also the percentage by the of the GDP that Israel invests in the R&D. So today I want to focus and selected some platforms that we work with in Israel and could be relevant to our cooperation. We'll start with the electronic health record, continue a little bit more with the health information exchange, telemedicine, big data, systematic innovation, and in the end, I'll talk a little bit on hospital management, a platform we use it here in Israel. So when we talk about electronic medical record or electronic health record, here in Israel, we use them already about 25, 30 years in our HMO and our hospitals. So we have a lot of experience of implementation of digital technology, specific in the electronic health record. We have, as Adi said before, 4 HMO. For each one, we have the unique EHR, and also in our hospitals. I want to focus on one example called Clinical. It's a lightweight EMR that did project established by the Ministry of Health 4 years ago. In aim to digitize units in the Ministry of Health that not have digital at all. And we start working on a fully open source software, and nowadays we finished the second version of this system that could be in use for each organization here in Israel. We talk about a small and medium organization, but I think it's a very unique project that also based on FHIR is a standard, the international new standard of a transformation of healthcare information between systems. And of course, it's secured, and we work with all these security standards in the world. The second platform I want to present today is the HAE, the Health Information Exchange. We start working with about 7 years ago in a national level. The Health Information Exchange helped us, and especially to the doctors in every point of care, to get the relevant data from all the network, all the hospitals, the HMOs, and to get more relevant treatment that's based on data to the patient. As you can see here, here is the network that already connected. You can see the hospitals in the one hand, the elite hospitals, in the second hand, you can see the governmental hospitals. Of course, all the 4 HMO also connected, and we have the other hospitals that is not governmental or the elite, and also we connected to the Israeli Defense Force. And the data, you can use the data to let the patient more relevant and more quality care. During the COVID-19, as you can see here, we use this national HAE to get data, very relevant data about the vaccines, about the infection of COVID-19. And it helped us also in every point of care, but also in the national level to get more relevant data in real time, to diagnose it, and to get the real and relevant decision in real time. The next platform I want to talk about is the telemedicine. Here in Israel, we have 2 kinds of usage in the telemedicine. The first one, in the HMO, we have the doctor-to-patient telemedicine. We use it for a family medicine, pediatric medicine, and also for pre-triage. It very helps us in the COVID-19 period. So we don't want the patient come to the clinics. So we can use those platforms. The HMO can provide this solution remotely. The second usage we have in the hospitals. Also, we have doctor-to-patient. Of course, when we talk about a chronic disease patient that we don't want them to come to the hospitals in the COVID time, we can continue the treatment remotely. And the doctor-to-doctor, when we talk about hospitals from the periphery, they can get a consultancy from the colleague in the center. And as you can see here, we have various of solutions and companies here in Israel in the field of telemedicine. Of course, you can see and you can imagine all over the world we see all the numbers raise up with usage in telemedicine, as also here in Israel. The last platform I want to talk about a little bit is the hospital management platform. We work with the Directorate of Government Medical Centers. And here we have some platforms that could help to the hospital's manager and also to the employees. We have a BI solution, we have big data solution in the field of risk management that be very relevant in the hospitals. We have a very interesting solution that can help us and alert us to avoid mistakes in the process of the treatment. We have strategic map that pronounce management and methodology. It's connect to the quality of care, as I mentioned before. Also, we have in the field of HR processes, and it also be very relevant in the COVID-19 period, that we can monitor all the employees, the doctors, the medical team, to know all the information in real time. And of course, in the field of command and control, we have the CoView that gathering all the information in real time from all the hospitals. In Healthcare Israel, we believe that when we provide a digital health technology, it's not come along. We have to take into account all the aspects around it. We start with the strategy, the security, the regulation, the incentive, and all this together make the process and the project more successful. In the end, I want to suggest some possible areas to cooperation, from building the regional national digital strategy to make pilots, implementation of HAE, hospital management tools, and telehealth and remote care solution. Thank you very much.
Thank you, Mr. Amir. Next, I think this is a really good segue for Rahul to actually now talk us about data portability frameworks for facilitating digital health within India. Rahul?
Thank you, Shambhavi. Thank you for having me. It's a pleasure to be here. It's a tough act to follow, Israeli tech, and so I'm not going to even attempt to do a slide. I'm going to take you through India's DEPA architecture. The DEPA architecture in India is essentially a data exchange architecture. But it came from this concept. The articulation of the concept was that India may not be economically rich, but it is data rich. And the way in which India will become economically rich is by using its data to its advantage. So how do we create a framework that will allow us to use the data that has been collected in multiple data silos for many years to become more accessible to the user? So one of the first things we did was, we created in our personal data protection bill, which is currently before Parliament, this concept in data protection. As you know, everywhere in the world, we talk about in data protection, the data subject. And we don't call them the data subject in India, we call them the data principal. And the data collectors or the controllers elsewhere, we call them the data fiduciaries. And the concept is that the data of the data principal, which is the user, is the most important thing. And every hospital or every diagnostic laboratory that has that data is holding it in a fiduciary capacity as in a state of trust for the data principal. Now, what this implies is that if the data principal wants to transfer data from one data fiduciary to another, it should be very easy. And the challenge with the DEPA architecture was really to come up with a mechanism for porting data, not all of the data, but just individual pieces of data that is required for some purpose or the other in a safe manner at population scale. And I think it's really important to say population scale because our population is 1.3 billion. And we have some significant geographical challenges as well. And so the systems that we build, when we say population scale, really have to be scalable to a level that perhaps is not required in many other countries on the planet. So very quickly, I'll take you through the elements of the DEPA architecture. I must, before I start, tell you that the DEPA architecture is a cross-sector architecture. It was first implemented and is most advanced in the financial services sector, where we've got what we call the account aggregator framework for movement of data between banks, non-banking financial institutions, etc. But the second most advanced is in the healthcare sector. DEPA is a core part of the National Digital Health Blueprint. What I'm going to talk about now essentially is that, and while I do that, Shambhavi or Manoj, if you can allow me to share my screen, I may right at the end of my talk pick out one slide to explain it. Sometimes this thing, what I say may become too difficult to understand without drawings, but I'm going to do my best right now. So the whole DEPA framework is built on this concept of an electronic consent. And the electronic consent is an artifact that allows consent to be encoded digitally. And when I say that, what do I mean? If you want to, as a data principle, provide consent to the movement of data from one place to the other, we have an artifact, which is essentially a standard, it's an XML standard, which encodes into the request the information of the data fiduciary that currently has the data, information of to whom it must be sent, the details about the purpose, and any other types of information such as retention limitations, etc. I'm using, as a lawyer, I'm using language which is very data protection heavy, but if you recognize it, these are core privacy principles, and these principles are encoded into the data consent artifact. The second thing that we have done is we have disintermediated the consent flows from the data flows. How do we do that? We have created a class of intermediaries called consent managers, and the consent managers vary. They have different names in different sectors. In the financial sector, for instance, it's the account aggregator, and in the healthcare sector, it is going to be the consent manager. So when you want to transfer data from one hospital to another, and let's just take a use case, if you want to get a second opinion, you will go to your consent manager, make a consent request. The consent request will specify what is the data that you want to transfer. Let's just say it's a cancer diagnosis. You want to get all your scans. You want to get whatever other current medications you're on, all of those things. You can make a specific request for that. And then you, on the basis of that, the consent manager will get an authorization from you. It will be digitally signed. That digitally signed consent artifact is then sent to the health information provider that actually holds that information, and they must respond on the basis of that digitally signed artifact. But then the data will actually flow directly from the health information provider to the health information user, in this case, the doctor that's providing the second opinion. The reason why we have the consent manager is because we believe that this aligns incentives properly. And we believe that the consent managers in this construct are entities that are really looking to, in some way work in the interests of the data principle. I'm going to see if I can actually pull out. I don't know if I'm going to be able to do that, but the benefit of this system is really that, and this is how we're seeing it in the financial services sector. We're about to roll it out in the healthcare sector. Is that we're seeing more and more innovative models building up, which are very focused on the individual user. We're finding that the incentives are now aligned to actually move data seamlessly. And from a data protection perspective, we've solved a critical challenge of consent. And that critical challenge of consent is that right now, the only way in which we can collect consent from a user is at the time that the user signs up. And so we find that privacy policies load the consent upfront. And there's a lot of literature about no one really understands the consent they're providing, because there's this long form that says you can do all sorts of things, including transfer it in the future. What the DEPA architecture allows is for a just-in-time consent to be provided for micro-portability. So no longer will you need to collect consent upfront to say that at some later point in time, I'm going to transfer this information to anyone else. Just in time, when you need it, you can seek the consent. That consent is actually very narrowly constrained to the specific data that you want and the purpose that you want to use it for. If you want, you can also include retention obligations. And these retention obligations, as you know, from a data protection perspective, is very important from the minimization principle. So we're hoping that once we roll this construct out, that we're going to be able to, one, have more informed decisions, that users can understand exactly what they're transferring for, have more auditable data transfer flows, because this is entirely digital and therefore completely auditable and trackable. And in the whole process, we're hoping that that first statement that I made, which is leveraging India, the fact that India is data rich, to make India economically and from a health perspective rich as well. I will pause there and maybe leave any questions for later.
Thanks, Rahul. I am audible, right?
Yeah.
Cool. Thanks, Rahul, for that talk about data portability. I would now like to ask Mr. K. Chandrasekhar, who represents Forest Health, about what he perceives as the role of the private sector in rolling out digital health services in India, and how can we better enable this participation of the private sector.
Thank you, Shambhi. Thank you. It's a pleasure to be part of this panel. India has obviously the second largest population in the world, and the magnitude of different disease burdens are quite high. And our doctor-patient ratio is also reasonably skewed. And when you get into specialities, it gets much more skewed. So the space in which we work, the ophthalmology space, we have one ophthalmologist for about 65,000 people in India. So it becomes fairly difficult to deliver care. And given that quite a high percentage in India and also a lot of countries is out of pocket, it becomes very important that you start doing preventive care rather than just doing curative care, because it comes in the later part of the disease and it is much more expensive. So when you want to do preventive care, then it becomes very important that you are moving away from where the hospital is. You're screening or diagnosing at a place where the patient is or the consumer is closer. And obviously, then digital has to be an important play, right? I think it's not because digital is very fancy word to use today and all these jargons which are being used. I think it is more relevant primarily because of the burden of the disease, right? So we work on a mission of eradicating avoidable blindness, right? Now, if we have to do that, we need to do the entire value chain. So we must have the last mile devices, which does the imaging or the reading. Then you have operators who operate it, who are semi-skilled, not fully skilled, who are in the hospitals. Then you have the framework, telemedicine framework if required, where a doctor and patient can consult. Then you have an artificial intelligence framework where as soon as the images are taken, it kind of gives a yes or a no, and then only the no goes to the, the yes goes to the doctors who have to grade it. And then you can't stop there, because your goal is not just to screen or identify patients, but you need to also give them solution. The solution could be a pair of spectacles which could solve the problem. The solution can be as complex as a surgery. Now, if it's a surgery, you need to connect them to a nearby primary government or a private hospital. And then if it is a simple thing like a pair of spectacles, you take the reading, you do the measurements there, you ask the consumer to pick up what he wants and deliver to him at his home. So the entire spectrum has to close for the problem. So it's not just, I won't look at it as digital. These are all components which are required to solve a problem. And obviously digital is a much more powerful medium, because it kind of brings down some of the limitations we have, like the number of doctors or the last mile gap. So private sector obviously can play a big role in some of these specialities, primarily because there is a need to reach the last mile, right? Now, there are government centers, there are government, what we call as the public health centers or the community health centers. Now people go there when they have a larger problem, right? And that is a problem which they are aware of, or they kind of have a symptom. But a lot of these eye or some of these other problems are non-symptomatic, right? Now you can do that only when you do periodic checking closer to their home. And that is where the last mile care. So you need to have devices which can do that in the last mile. You have the connected software, artificial intelligence, platform, delivery. All of these are integrated so that the end goal is kind of met. So I think we need to look at it. Are we meeting the whole objective, right? Of course, digital is a medium, but digital isn't everything, right? It is, end of the day, actually the most important thing in this whole thing, and which I have realized, is that you can do all of that, but if after identifying somebody with a problem, he or she doesn't go to a doctor for treatment, all of this is a waste of time, right? Because the end goal is to do that, right? So I think the scale of preventive care can be, with the limitations we have, can be only fulfilled by digital, right? And of course, you'll have to take care of, so when you do a lot of good things, there'll be a lot of other problems like data privacy and data leak and all that. So I think it is very important for you to imbibe all of that right from day one, right? And right to introduce how you can protect, because the place at which the patient is screened, obviously there is an awareness of who the patient is. But the place where the patient is being diagnosed doesn't need to know. So the medium in which it travels, you can kind of remove all the patient connect, do only the data, get back the data to the place where it originated. And then obviously that place has got, so the consent and those other things becomes easy because the place to which the patient or the consumer is giving the consent is aware of. So I think this is the first part. The second part, I think Israel fundamentally has got a great innovation example. They have phenomenal areas of expertise, especially in our area. They're pretty good in optics. They're very good in making miniaturized stuff. They're very good in IoT. I think what the collaboration can basically bring is, if in Israel, it will take you to do 100 people testing of your concept, let's say 1 month, we will do it in 2 days in India because we have that population. We have doctors who are actually willing to spend the time. And most importantly, we will get a variety of cases. You'll get all corner cases. You will not get cases which are very straightforward, right? So when you're putting it in a use case, what I talked to you, you are not actually doing it in a hospital environment. You're doing it in a very remote location, uncooperative patient, old patient, operator not fully trained. So if you're creating AI or platform or device, it has to work on all this. There's no point in making a device which will work only in hospitals. I'm saying that is useful, but not really useful for mass screening and mass deployment, right? So you need to have products which will work in those. And I think Israel has the technology. And when we collaborate with countries like India, we can actually help them to build a cost-effective, value-engineered solution, clinically tested, large sample size, working on all corner cases, and a model which will be, definitely scalable across the world. So, you can build this model here, run this model here, and you can replicate it easily to Latin America or Africa or parts of Asia. So, you just need to change the language, in the app and things like that, and then can be deployed. So I think that collaboration, the innovation comes from there. The value engineering, customization to the disease happens in India based on various testing, and then the deployment happens, and then jointly we can scale it globally.
Thank you, Mr. Chandrasekhar, for making those excellent points. Before we head to the panel, I finally have get to ask Ms. Netali about the role of the private sector in Israel, and importantly, what is the role private equity can play in financing healthcare in our countries?
So, sorry, can you repeat the question?
The role of the private sector in Israel in providing digital health, and what role can private equity play in financing healthcare in Israel and in India?
Yeah, so I have some slides, but maybe I'll just do it more informally and first give some background on TriVentures, our fund, and where our focus areas are and where we think the great opportunity lies in the space of data-driven healthcare. So we are a fund based in Israel and the Silicon Valley. We have approximately $200 million under management. We are largely focused on seed A and B rounds, so early stage. And we today have most of our investment focused on data-driven healthcare solutions, what has been previously called digital health. We actually started our path over a decade ago in early stage medical devices, but the founding partners already in this first fund recognized that the major transformation in the space of healthcare was not going to come from the next valve or stent, but it was going to come from data-driven healthcare solutions. And the reason for this is, you know, there's so much opportunity in healthcare when we look at, you know, the characteristics for industries that are ripe for disruption. It's consumers are unsatisfied. There's a lot of new technological innovation, but it's underutilized. Products and services are not affordable for the general population, and inconvenience is at an all-time high. And I cannot think of a better way to describe healthcare across the globe in most of the countries. And where we see the greatest opportunity to come in and disrupt this domain is on the convergence of healthcare and other technologies, healthcare and other verticals. So, you know, traditionally healthcare problems have been solved from a very clinically focused lens, but actually we believe that many of healthcare's non-clinical problems, the financial, the administrative, the logistical problems actually will have impact also on downstream clinical. So many of the areas that we're interested in are things like fintech for healthcare and insurtech for healthcare, cyber for healthcare. We're very interested in entrepreneurs that are coming from other verticals in the tech industries, have built successful businesses and models in other industries, want to take these models and apply them with the right adaptations to the healthcare industry. And for the purpose of this discussion, a common theme that came up was around data. So for example, one of the companies we have in our portfolio, LinksMD, has developed a marketplace for data exchange and monetization to enable parties to share their data in a secure way, but also enable those data owners to leverage and monetize their data assets in a way that maintains the integrity and security of those data. We have another company in our portfolio in the genomics space, which has created the first professional open source genomics community in the world, and actually the first professional community that I'm aware of in healthcare, where geneticists and anybody that's touching clinical data around the world is proactively coming onto the company's community platform and entering data to exchange insights and solve unresolved cases through this open sourced data platform. And you know, I don't think that we would have come to this kind of unique concept had it been just bioinformaticians that were in the company. We have people that came out of Waze and people that understand what it takes to build viral effects and community effects. And so these are just examples of some of the areas that we're excited about and looking at. So bringing in different ways to look at the problems and challenges in healthcare and bring novel solutions to the community. And so for us, as you know, we're all in our fund, we all come from a variety of backgrounds. We all have healthcare experience, different parts of the value chain, clinical, regulatory, operational, transactional, and we all worked in startups at some point in our careers. So we're also a very entrepreneurial team. We work very closely with the entrepreneurs. We're very hands-on. We try to invest in spaces where we not only bring capital, but we think we can help in the company progression. And we also work very closely with the industry. So we're the money, but the money behind the money is much of it is coming from strategic investors. And strategic investors come in two types of categories. One are corporates in the medtech space, health systems, insurance companies. And the other flavor is local regional partners that can help our companies find a footprint in those local countries, because what we know is you can't successfully cross borders without having a very strong partner that knows the language, that understands the culture, that understands the subtext. And so we have also partners and investors that come from various regions. And I think, in terms of, enough was said here about why Israel is very unique with its data asset. It sounds that India also has a unique asset to leverage. It is a huge accelerant for innovation when you combine it with the talent pool that we have here in Israel. So, historically, it's been, while we have this very unique data asset of 30 years of accumulated longitudinal data of patients, it's been very challenging to get those data out of the health systems and allow startups to innovate. What we've done to help and facilitate that, we've established an exclusive partnership with Shiva Medical Center. It's the largest health system in Israel, one of the top 10 health systems in the world. And what we do through that partnership is, to the extent that it's beneficial for our portfolio companies, they're able to leverage the assets that Shiva has, including the data asset, which covers over 4 million lives. And I think that, we're very excited about this space. We were very excited about it before COVID. We were the first institutional investor in Israel to begin to invest in digital health in a very concentrated way before it was called digital health. And we've been talking about remote care and receiving healthcare services outside of the hospital for probably 6 or 7 years. We have a very graphic slide that talks about healthcare services in other places. And what COVID has done, for digital health, it's been a tragedy for the world, but for the industry, it helped to accelerate the mindset and the understanding that these services, the ability to receive and deliver care outside of the hospital, it's a must-have and not a nice-to-have. And so we're very excited. This market is expected to reach over 600 billion in 2026. Tons of opportunity and tons of inefficiencies and to be improved upon, and make health better for many people around the world.
Thank you, Ms. Natalie. I think we can situate digital health as a part of a very large ecosystem that can be run through interdisciplinary teams and requires support of policy mechanisms of trust, the health infrastructure in general, investments, and the innovation ecosystems. And I think then that kind of broadens the cooperation that India and Israel can have beyond just digital health. In the interest of time, I'm going to quickly move on to questions that we have received from the audience. Saujanya Sridharan asks, she's a researcher working in health data stewardship, and they would like to understand the visibility available to data subjects generators through Israeli Health Information Exchange platform. And as a follow-up, does the HIE share data with third parties beyond healthcare providers? If so, what is the data governance framework in place to authorize such sharing?
So the health information exchange is coming from, the aim is treatment, okay? So we can share the medical information just for treatment, and it allows, of course, we have some levels of permissions, and we can divide the information. Let's say in my organization, I don't want to share psychiatrics information with others. We can define it in setup. And no, we don't share this information with other entities like research. It's not from the HIE platform. As Natalie said before, we have another cooperation from the health organization with the industry to share data for research, but the HIE is not for this purpose. The HIE is just for treatment.
Thank you, Mr. Amit. Arjun Gidwani asks, how will the challenges posed by India's weak cybersecurity landscape and the connected complex legal landscape be overcome by both India and Israel to strengthen the collaboration with Israel in the area of digital health? Perhaps Rahul and Mr. Amir can have a go at this.
I mean, look, the only answer to a question like this is to improve the cybersecurity and limit the data exchange to those elements that can be adequately secured. The data architecture is designed to be a secure architecture, and if it is possible within that framework to extend the similar framework internationally, then that is, I guess, one mechanism to do that. But I think, as far as India is concerned, we really do need to also improve our regulatory frameworks. At this point in time, we don't have a data protection regulator. And I think that is key in order to be able to give the kind of enforcement muscle that it needs. And if we say that we have a weak landscape, I think that's a strong part of the solution. But the good news is that that's likely to be literally around the corner, and so hopefully we don't have this worry beyond a couple of months if the Parliament can push that through.
Thanks, Rahul. Rahul, another question for you actually from Pranay. Could digital health sandboxes be an avenue for international collaboration in this sector?
Yeah, absolutely. Look, I think sandboxes are really useful in any area of regulation that has a very strong digital component, because sandboxes allow us a controlled environment within which we can evaluate that technology and whatever relaxations are required in regulation or changes that are required in regulation to make it work. And I think, I was listening to Natalie, and I thought one of the interesting comments that she made was, using fintech in digital health. And I'd really be interested in seeing some sort of a sandbox around that. Our data architecture, as I said, is sector agnostic. So we have data in the financial services, we have data in the healthcare services. So fundamentally, those two data sharing infrastructures are interoperable. And it will be really interesting to find some innovative solution that will bring innovations in the fintech sector into the health tech sector. And I can imagine innovative financing models for with the data that you have in both sectors, different types of data, but highly interoperable. The opportunities for innovation, I think, would be really high. But this is the classic example, to answer Pranay's question, where you need a sandbox, because both the sharing of health data as well as the sharing of financial data is highly regulated. And you wouldn't allow this cross-regulatory flow of data unless you can test to see that there are no unintended consequences. And you would typically do that in a sandbox. So absolutely. I mean, the answer is yes, this would be a great opportunity for international collaboration.
Thank you, Rahul. I have a question for Ms. Adi and Mr. Amir. What kind of regulatory structures or data flow structures would you be looking at when you're thinking of international collaborations over digital health?
Can you repeat, please?
Sorry. So what kind of regulatory structures in terms of support, infrastructure, data flows, etc., would you be looking at in a country that you want to cooperate with over digital health?
I think we have many opportunities of collaboration. Maybe as Adi started before, that we also already saw with the test, the COVID test, that we have a great collaboration with the India, and we can think together about other opportunities of collaboration in the regulation and also in data sharing and test cases together. We'll be happy to understand what the really and the warm area that interesting you and to continue talking about it, maybe in minimal group.
Yes, thank you so much, Mr. Amir. And thank you, audience, for the questions. I would now like to invite Ambassador Ron, the chairman of the Abba Institute, to give closing remarks.
First of all, thank you very, very much. And it's, I don't want to be repetitive, but what I really enjoy is the fact that, you know, we both institutes are more practical in the sense of to do tanks and not think tanks. And I want to thank especially Adi and Amir on presenting this, you know, from a Israeli national perspective. I think that I really connected to what Raul talked about, because it's like a balance. Here is the mouse and the elephant. We are basically saying, amazing, we are small, we basically are accessible. We managed to persuade Pfizer that we can be a laboratory because of the fact that we are small, we have HMOs, we have the information. And you all said, good, we are data rich. And the thing is that data rich and the difference between small and big here is something that we can work on, because it deals with protection, it deals with security, it deals with the issues that are compatible, because although we are so different, you deal with something on a much bigger scale that we would have to deal with, not necessarily now in COVID, but on other issues. So for me, this was really important. I'd like us to connect not just Natalie in the sense that came with an, you know, she's an amazing company and in the sense has added value. We have to find ways that Natalie would not be just the one, because she is now on the call. We have to find how Natalie, her space, can connect to what we want to do both on the national level and scale. And we have to find ways to do that. I think this is an amazing, amazing space to work in between Israel and India. It's something that not just has a future, but has a lot of challenges, and a lot of money is being allocated in this direction. I think Adi showed you at the beginning how Israeli health system, you know, hospitals and everything, without budgets, basically, it's not a good story. It's a bad story that we managed to survive, I would say, and not suffocate. But this is something that I think we can learn a lot from you, and I think you can learn you know, something from us because of the creativity and finding you know, solutions which I call out of the box. But thank you very, very much. It just shows that we should keep on cooperating, and I'm waiting to see you guys in India and inviting you over to Herzliya. Slowly, I hope at least Israel will be open to everyone, and wishing you from our angle, you know, that we have Passover. So for us, we hope that we will pass over COVID and other problems, and we'll see you and work with you afterwards in a more intensive way. Thank you very, very much.
Thank you, Ambassador. And on behalf of both of our institutions, I would like to thank the panelists and the audience for their participation and their questions. We will soon announce the next event in the series, and we will keep you all posted. Thank you very much, and see you all soon.